sit by and watch someone you love suffer endlessly in pain? Wouldn't you do everything in your power to ensure that this person would not have to hurt? These are two questions that I want you to consider deeply. You, as well as I, would do everything in your power to ensure that that person would never have to hurt again, would not have to suffer. Thousands and thousands of people are diagnosed with terminal illnesses each day. This could be cancer, could be chronic lung diseases. This is usually some form of treatment for these diseases, but there's not a cure. They're terminal. These people have to live the rest of their lives dreading what is yet to come. Could there be help for these patients? Sure there could. It's called euthanasia, or doctor-assisted suicide. Euthanasia is the process of ending a life in a painless manner. The term voluntary euthanasia is when the patient and the family actually give consent to the physician to help end the suffering for the patient. Dr. Jack Kevorkian made these words famous. He helped some of his patients that didn't want to suffer in their lives. He was actually convicted and sent to prison for these acts. This has been an ongoing controversy for many years. Activists claim that it's murder. Is it considered murder when the patient begs for relief? They cannot physically, mentally, or emotionally withstand the pain and distress the disorder, the disease is bearing on their lives any longer. Although the rate of cancer is decreasing each year, this does nothing for the ones that are suffering with it as we speak. In the year 2000, my grandmother was diagnosed with emphysema and breast cancer. We had to watch her health and her body slowly deteriorate right in front of us. At the time, we would have never dreamed of helping her in her life. But as the time went on and I look back, I wish we would have done things differently. She went from a vibrant person that spent her life caring for people as a nurse, as a grandmother, as a mother, to a person that couldn't even care for herself and not wanting anyone else to care for her. She did not want to burden us with that. She was eventually placed on hospice, a healthcare organization that bases their care on keeping the patient comfortable until death. Had my grandmother been in her right mind, she would have never wanted to live the rest of her life this way, on so many drugs that she could not function. She could not wake up. She would have never wanted that. Hospice came in at least 3 times a week, or unless we called them otherwise, and basically all they done was administered drugs that were meant to keep her knocked out. At first we were furious. How could they overdose her in this manner? When deep down we were just not facing the truth. Death is imminent. She was dying and we couldn't do anything to save her. After her death, I started researching this more. And although hospice does not call their care euthanasia, that is exactly what it is. And for this reason alone, voluntary euthanasia should be legalized. If hospice can do it and hide it in the manner that they do, why can't the family, the patient, and the physician choose to do it their way? Oregon is the only state in the United States that has a law of this matter. In 1997, Oregon enacted the Death with Dignity law that enables a doctor to assist the patients with death following certain guidelines, of course. But my argument is this. Why should a patient that is suffering endlessly in pain, why should their decision to live or die be left up to anyone but themselves and their family? No one should have to suffer their last few days, months, or years. For this reason, I argue that voluntary euthanasia should be legalized.